Just waiting for folks to join, so we'll give it a few minutes. Okay, so maybe I'll just get started quickly. My name is Andrzej Selinsky. I'm with the Reclaim Collective, and I'm a co-facilitator of the Thursday drop-in meetings for the Substance Use Health Network. I'd like to invite you all to join us for our today's hot topic webinar entitled Shared Purpose, a Community Guide to Ethical Research Partnerships. Uh, Joining us will be Tara Taylor, Isabel Boisvert, and Caitlin Caligari. So thanks. Thanks to have all you guys. Next slide. Can we go to the next slide? I'd like to share a brief land acknowledgements. Okay. And remind you that this presentation is being recorded. Okay. So as we gather today, we respectfully acknowledge that we are gathered on the traditional, unceded, and ancestral territories of many First Nations, Métis, and Inuit peoples who have been stewards of this land, Turtle Island. In acknowledging this land, we recognize that it is a living entity. It is a living entity impacted by centuries of colonization, forced assimilation, and the ongoing systemic violence of environmental extraction and unjust social policy. We recognize that the war on drugs and current drug toxicity crisis have disproportionately impacted Indigenous, Black, and marginalized communities rooted in a legacy of systemic racism and intergenerational trauma. We acknowledge the profound loss and suffering caused by punitive policies that have treated health issues as moral failings, leading to mass incarceration and an unsafe toxic drug supply. We honor the memory of all those lost to the toxic drug policies, and we commit to taking action toward true reconciliation by dismantling oppressive systems, upholding Indigenous sovereignty, supporting community led harm reduction, ensuring the safety and dignity of people who use substances. Okay. All right. Next slide. So you're putting on this webinar as the Substance Use Health Network. We've reached 2,000, almost 2,000 people. If you like, we could share a link in the chat for folks who want to join and attend future webinars or Thursday drop-in meetings. So yeah, there's a QR code there that you can also scan if you'd like to join. And the website is in the chat. Next slide, please. I talk a little bit about Reclaim Collective, which I co-founded about a year and a half ago with some colleagues. We're a lived experience collective that works with researchers and on various projects. As consulting and advisory services. We do education, training, and facilitate webinars and co-produce knowledge with other folks. And we also help with event planning and community engagement projects. Our work is rooted in harm reduction, um, and yeah, all of us, come at it with our own kind of lived experience and having, worked in this field for some time. So yeah, if you want, I'll share our website in the chat, or and yeah, check it out if you have a chance. Next slide, please. Okay, so housekeeping, just to remind everyone, we're recording this event and we'll share it on our website, the Substance Use Health Network. English closed captioning is enabled. A discussion will follow the presentation. If you'd like to ask a question, please use the Q&A box, and there'll also be a poll provided for folks to fill out during this webinar. So without any further ado, I'll pass it over to our presenters. Tara Taylor, Isabel Boulevard, and Caitlin Caligari. The webinar is entitled Shared Purpose, a Community Guide to Ethical Research Partnerships. Thanks.
Okay, awesome. Thank you so much. I'm just going to take a moment to get our slides up. Okay. And can everyone see those okay? Yeah. Awesome. All right. Well, hello, everyone. Thank you so much for joining us today. We are very grateful and very excited to be able to present about Shared Purpose, which is a community guide to ethical research partnerships. So this guide is a practical tool that was developed by and for the community, and it was developed with the goal of helping community organizations build more ethical and more resilient partnerships in research. But it can also definitely help research professionals also ensure that community voices are integrated properly at all levels of the research process. So before we begin, I would like to acknowledge that Changemark's work takes place on the unceded, ancestral, and stolen homelands of the Musqueam, Squamish, and Tsleil-Waututh nations, as well as across Turtle Island. And so as we all sit here together today to talk about harm reduction and autonomy and care systems, it's essential to remember that colonial systems, including healthcare and research, continue to shape inequities experienced by Indigenous peoples. And so, as allies, we can support Indigenous sovereignty by advancing models of care that center autonomy, that center self-determination and equity, but also by ensuring that Indigenous voices and Indigenous leadership guide how research and programs ultimately evolve. And if you haven't already, we do invite folks to drop their own land acknowledgements in the chat as we continue on with the presentation. Okay, so before we get into the presentation itself, we're just going to do some brief introductions. So my name is Caitlin Caligari. I am gratefully joining today's call from the traditional ancestral territory of the Anishinaabes people of the Three Fires Confederacy, as well as the lands of Caldwell First Nation under Treaty Number 2. So I'm currently a project manager with Changemark Research and Evaluation, and just a little tidbit about Changemark for those of you who are unfamiliar with us. Changemark is a woman-owned, social purpose-driven CRO, and we specialize in mental health and substance use research and evaluation. Our goal and really our practice is to really put people and equity at the center of everything we do. And we really believe in the power of elevating community voices and working collaboratively with folks most impacted by issues and with lived and living experience to build better solutions for everyone. I've been working in this space with Changemark for about 4 years now. I hold a master's of public health, and prior to working with Changemark, I worked more broadly within the public health system in Ontario. But now I will turn it over to Tara to introduce themselves.
Hey all, my name is Tara or Tara. I go by both really, so whatever feels right, roll with that. Currently, I'm the executive director of the Spencer Creo Foundation, which is a local Vancouver foundation, loose mandate to create and support transformative opportunities for individuals. That gives me a very broad thing that I get to work within. Historically, I guess I've been working in Vancouver's downtown east side about 20 something years. Lots of work within peer work, persons with lived and living experience, social enterprises, harm reduction. I spent about 8 years, working closely with the Overdose Prevention Society. And in that, I came across working with a bunch of researchers, and so we'll get into a bit of the history of that there. But that's me, Isabel.
Hi everyone, my name is Isabelle Boisvert. I use the pronouns she and her. I live and work on the traditional and unceded territory of Tiohtià:ke, also known as Montreal. home of the Ganyan-Gehaga Nation. As an uninvited settler, I acknowledge my responsibility to act and work with respect, reciprocity, and inclusion. First and foremost, I'm a person with lived experience. So for more than 15 years, I used a whole bunch of substances, including crack cocaine and opiate injection. I've now been sober for more than 6 years. During my years of using, I did sex work, I experienced homelessness, I overdosed several times, and I engaged in criminal activity to sustain my drug use. I definitely have firsthand knowledge of the healthcare and social service systems, having used them repeatedly over the years. Professionally, I've been working in substance use and sexually transmitted and bloodborne infection research for a couple of years now within a leading research center in Montreal. I'm also the partnerships lead for CRISM Quebec node. I've developed, implemented, evaluated peer-led recruitment strategies for a large cohort of people who inject drugs in Montreal by personally conducting fieldwork, analysis, and knowledge translation. And I recently became a published researcher, which I'm very proud of. I work closely, very closely with harm reduction and community organizations across Quebec. I'm also a public speaker and an advocate for nothing about us without us within research and policy contexts. It's important to note that shared purpose is really grounded in lived reality and strengthened by rigorous research and system level insight. Next slide, please.
Okay, awesome. So I can just go over our agenda pretty quickly. We have a couple of different items for today's presentation. So we're going to be providing an overview of and some background on the guide itself throughout this presentation. We'll go through the guide's creators, the reasons for its creation, its core guiding principles. We're also going to do a quick walkthrough of its 7 chapters and some of the practical tools that can be found in the guide. And we're also going to be going over how to use the guide, and then we should have a good amount of time left over for Q&A at the end of the presentation. So if a question arises for you at any time during the presentation, please go ahead and just enter that into the Q&A box so that we can address them. We might pull a couple of questions as we're presenting if they're relevant. We did leave a good chunk of time for Q&A at the end because we really want to be able to answer all your questions or discuss any feedback or experiences that you might want to share with us. So definitely don't feel shy. We're super happy to talk to you all. And with that, I will turn it back over to Tara to give us an introduction to the guide.
Awesome, thank you, and thanks Isabel for sharing your yeah, it's so important that we share our lived experience, you know, when we're on these calls and having these conversations. I always get so nervous when I introducing myself. I have no idea what I should be saying, what I shouldn't be saying. Yeah, it's just, anyways, it's interesting sometimes to talk about yourself. And yeah, just thank you for naming your lived experience. I'm also someone who lives with lived and living experience. Still used recreationally. But definitely did have some more of a survival substance use in my past. I wouldn't be alive today and where I'm at without the experiences of working as a peer. When I first came into the word peer or persons with lived and living experience wasn't what was happening. Like we weren't talking about it. A lot of folks had it, but no one was hired on the basis of that. We weren't using those titles, you know, and so it's to me the some of the background of why the shared purpose is so important to me is I know research changes policy, research makes, you know, spaces for expertise and lived voices coming forward. But I've also had the experience working with some researchers that don't have that, you know, and because I've worked with such amazing researchers, I knew the difference. I knew when it wasn't happening. I knew like I was being like that like one of the orgs I was working with my safe should have had a lot better reporting coming out of it. It wasn't engaging with some of the community as much as I would have hoped, and I didn't know my rights in it. Learned, and so working with ChangeMark, starting off trying to make the MySafe report is where the shared purpose guide came from, in kind of sharing some of my experiences of what it was to learn how to do research alongside researchers, right? So when we created this shared purpose guide, it was kind of the idea was sometimes researchers and projects come in, they do a lot of work with folks in community, and then they never hear back. Like community never hears it back, right? And so it's one of the things is this guide, it's we're gonna, like I said, we're gonna break it down. The intention is you can pick it up at any time, and it kind of helps you just land where you are with research to do it. You can read it the whole way through if you want, but yeah, the intention isn't to just read it and then put it back on the shelf. It's to use it ongoing. And it's kind of based off of some of the stuff Vancouver was doing with Research Manifesto 101, which was working closely with community members to create ways that researchers could engage with research. It also was based off a lot of work I was doing around OPRA, which is the Overdose Prevention Peer Research Assistant. All of those were funded programs in which we were building capacity for peers and community members to do research, but not a lot of it on the other side of it for researchers to do community. So that this is just building on that. It's always important to acknowledge where the history is and what building blocks get to the next stage. Next slide, please. So yeah, again, we couldn't have done this without a bunch of folks. That you can see the names up there, and we'll go over naming some of the organizations. But a big part of collaborative research, well, community-based research should be collaborative, right? So it only makes sense that as we are creating a guide for that, that we'd co-create. So we've already named that Changemark was a part of it. We also throughout the guide reference Cleolium, which is Indigenous Co-op Medical Clinic in the downtown east side. Matthew Fleury is someone who has been a lead in a lot of incredible Indigenous research that's happened and like helped create the Cleolium, the contract that we use in the guide that we'll get to. So as I said, we have brought in, like you said, there's elders, there's peers, there's community, there was research. There's no point in making a guide for everyone to use and not in continuing to use everyone and work with everyone to create it, right? So like if all the peers just created it, we've missed out talking with the research. If it was just researchers that made it, we'd missed out talking with the peer. So it's just, again, everything about this guide is all collaborative with the intention of all research should be collaborative. Next slide, please.
Sorry. So research definitely has the potential to be transformative, but as we know, it's not always done well. Too often it's top down and extractive, especially for Indigenous, racialized, and marginalized communities like people who use drugs. However, as Tara was saying, research is important and it can be very powerful. It can unlock funding, shift policy, it can validate lived experience, but often it reinforces harm. And for example, when projects end abruptly without continuity, when communities are asked for input on decisions that have already been made, when benefits don't flow back, sometimes risks and harms will increase. So it was clear to us that community organizations need tools to evaluate alignment, capacity, and benefit. I think when I started in research from a personal perspective a couple of years ago, it was all very overwhelming and intimidating, how research worked. And this kind of tool that we've created is really to help simplify the process and make it less intimidating. And this guide also exists to change that dynamic. So by providing a framework to pause and ask yourself, does this research partnership align with our community's priorities? Do we have the capacity and the resources to participate meaningfully? And it also encourages reciprocal relationships where both the community and the researchers benefit, because it's important that both sides benefit. That is just, it's not just one-sided, obviously. And it helps ensure accountability throughout the research process from design to dissemination. Next slide, please. Unfortunately, however, the reality often is that communities are excluded from recognition. Researchers frequently fail to report back or properly cite community and peer contributions. Peer and community labor remains largely invisible. It's underfunded, undertimed, and rarely acknowledged despite its central role in community-based research success. It also makes the research process explicit, naming the relational, ethical, and practical work often left undocumented. And when the guide can also be useful, even if you're approached by as a community organization, let's say you're approached late in the research process by a research team, this guide still helps you ensure that the remaining steps are done ethically and properly. As an example, I worked on a project for a couple of years in Montreal where I was conceiving, implementing, and evaluating peer-led recruitment strategies in a cohort of people who inject drugs. And I was able to quantify the peer-led recruitment pipeline. So that work is currently under peer review, but basically what it showed is how much peer-led work and outreach is needed to enroll people who inject drugs in research. So out of 2006 interactions that we documented with potential participants during community-based during community-based research at the harm reduction organizations and during street outreach, only 144 people who inject drugs were ultimately enrolled. So that equates 7% of total interactions. And this huge gap basically shows the immense amount of work required by peers to engage participants, as well as the multiple barriers to engaging them in research. What we also saw was that First Nations, Inuit, and Métis communities, ethnic and language minorities, and women and people who identify as gender diverse were actually more likely to disengage before enrolling in research because they faced a lot more structural and systemic barriers. So all that being said, that work is invisible. It's rarely considered in research funding, allocation, and distribution, but it's absolutely necessary in community-based research and fully peer-dependent. Next slide, please.
Thank you. Did you say you did 2006 in peer interviews?
No, interaction. So basically anyone that we were speaking with on the field, we were documenting so that we could understand how far they were getting along in the engagement process. So it's basically pre-enrollment efforts that are needed.
Yeah. It's such a vast number. It's exactly that many interactions, right?
Yeah.
When we start talking about the guiding principles, for me, it's important that we just start with like the simplest message, and that is that to remember that you are not a sidekick to research, that actually research is it you are not a sidekick to research. You are why it matters, right? And that was something I just didn't understand. Like my journey of working alongside research definitely started the first many years of, I guess probably the first 12 years of working the downtown east side, I was anti-research. I just didn't see the benefits. I only saw like it not being done in a way that felt respectful. And then when I started working on the the Oprah project with Jeffrey Morgan and Stephanie Gligg, it was that's when I realized, oh, that I'm just missing respectable and like ethical research, right? And so like the phrase that I'm not a sidekick to research, it's why it matters is like it's such a flip and it's an easy one to grasp onto. And if ever you're working with researchers or people have reached out to you on a project and it doesn't seem like that lands, like it's just a really simple way to bring it back to and it should. And it's a big guiding principle on this workbook that we'll eventually be sharing with you. I know you can read it on the screen, but I was gonna go over each of the principles and just kind of how they land, right? So these are the 6 guiding principles. Respect. And so respect should be for the cultural, emotional, and intellectual contributions of community, and of research. Again, it goes both ways. One of the ones we get into is the next word. I have such a hard time with this word. Reciprocity is a word that I always say wrong, but I know that you all know what I'm trying to say. And that's, ensuring that there's benefits flowing both ways, right? And it's kind of one of the questions when I was going through the process of Oprah, and I refer to it a lot because it's for me personally where I understood why research was important. what the concept of Oprah was working with 15 folks from the downtown east side who had an interest in research, who hadn't. We created a research topic and then spent 5 years learning everything from the TCPS2, which is the ethics that you need to pass in order to do research. We actually work really closely with Jean Roots of UBC. It's usually an online course that's full of academic language. You have to have access to the internet. You have to be able to have 3 hours to sit through it all. We're able to take that and break that into like a 6 week in-person class that where we were able to teach it, and then it was recognized as the same certificate, so that the folks that were a part of Oprah could then participate in research from the very beginning, right? And so Oprah's intention is the very, very beginning, the very first question that you have should be working with community to create the question that you're researching on, and every step of that, every step of the way, like what are the interviews, who are we interviewing, how are we going to collect it, like all the things should include like at least one person from community that's able to speak to a lot of that. And so in that's when I learned that the reciprocity of research and community wasn't working, and because it wasn't going both ways, I was just feeling it one way, right? And again, not all researchers, just some of the research I was seeing. And when I saw how people can do it respectfully, empowering, and with a shared core, I understood how good research could happen. Another guiding principle is responsibility to uphold commitments, prevent harm, and honor protocols. Again, if people are coming into community, like what is the commitment to community? How do we always make sure we're doing the least amount of harm, if at all, no harm? And what are the protocols that are already existing and how to work within that? Also really important, relevance. Like there's when I was on the board at the Overdose Prevention Society in Vancouver, we started having there was especially during COVID, so many people wanted to do research on drug users. At a consumption site during COVID, like literally everything that had ever popped into someone's head, they wanted to do it, especially because everyone was working from home, except for those who were working on the front lines, and so a lot of it wasn't relevant. It wasn't useful to the people at the consumption site. It was useful to a researcher who had a question. So it's important that when you're working with research, what is it relevant? Like, what is the relevance? Is it a community need? Does it build on strength? And is it a priority? So if it's not, like you don't have to work with every researcher who has an idea. Make sure it feels like it lands with relevance, right? Relational accountability, so important. That should be rooted in trust, care, and long-term connections. There's researchers in the downtown east side that have been doing research for like 20 some years, right? That is because they have built some trust, they have long-term connections. And so when they bring back another idea or another project, peers and community are willing to work with them because there's that relational accountability since the beginning. And then lastly, one of the last guiding principles is the representation. So that reflects the lived realities, not deficit-based narratives. Um, it's important that I'm again referring to the downtown east side because that's where I've done most of my work and most of the research is there's often a narrative of drug users, a deficit-based narrative of drug users, deficit-based of folks with mental health, with poverty. So what is it the person's trying to prove? What is the project trying to prove? If it's deficit-based, find a way to make it positive based. You know what I mean? Like it doesn't always have to come in, and we want to make sure that the representation isn't always continuing on the stigma that we're seeing in the communities that we're working with. Yeah, so that's the guiding principles. I don't think any of that should land in a way that doesn't be like, why would we? Again, this is always just a guide. If you have more principles that you want to do as with your organizations, use it. I always encourage. Almost everything I do is like copy left. So it's yours to use. Take it and make it yours. These are just like guides and framework to have a jumping off space, but it's like a great place to have a conversation with your internal organization, being like, which of these lands, which do we want to create, which do we want to make a focus? Next slide.
Awesome. Thanks so much, Tara. I really appreciate the extra personal sentiments and examples here. I think they really help to bring the guiding principles to life that have been embedded in the guide. I am just going to pause here because a really quick question came in for Isabel about whether the research you were speaking to has been published yet.
No, it hasn't been published. It's being peer reviewed. So I write it early January. The journal editor sent me a message saying it's been sent for peer review. So hopefully it will be published in the next few months.
Awesome. Thanks so much.
So I will take this slide. So the guide is really super user friendly. We designed it to be practical, easy to use. We know, all the hard work that's going on the front lines in community organizations and how your time is super valuable. So we really wanted to make it easy to use. You don't have to start at the beginning or read it all at once, like Tara was saying. Um, it covers all the entire research cycle, from funding to research design, ethics, recruitment, data collection, um, analysis, results, and dissemination. And what you'll find are real world examples and community based insights. There's a checklist, decision aids, and sample agreements that you can adapt to your organization. Reflection questions to help assess the fit and readiness, and a curated library of additional resources. And basically, think of this guide as a conversation guide that you can pick up whenever, or even when you're revisiting a research partnership, if you're involved in partnerships already. Inside, you'll find a really consistent structure, such as short chapter summaries, discussion prompts, reflection questions to help your teams think critically about alignment, benefit, and risk. And each section includes practical tools drawn from community and Indigenous research experiences. Next slide, please. The final section of the guide is actually my favorite. It's from page 49 onwards, and it's a full toolbox with practical, customizable resources that you can adapt to your community context. The idea is that no one should have to start from scratch when deciding whether to take part in research. There is a readiness checklist to help you assess whether a proposed partnership aligns with your mission and capacity. There are sample memorandums of understanding that lay out roles, data ownership, and mutual expectations. I really like the red and green flag negotiating tips. There's a whole bunch of other documents, as you can see, that I think you'll find really useful. And the intent is really to make the guide something living, adaptable to your community's needs, and a resource you can return to at any point, not just at the beginning. Next slide, please.
All right, toolbox example. I am going to put on my reader glasses because I forgot to print this off in a big font. And so I'm going to try to read this to go through it. I think most of you can see it probably on your screens a bit there. But again, like Isabel saying, there's so many examples in the guide of like actual templates on how to use something until you make it your own. Again, these are just examples of what we've used. Definitely like add what you want to add, take away what you want to take away. In true, if as you're working through this, you see something that's like highlighted that you're like, oh, you really should have had that, or this would make it, please email us. Like at the end, we'll show it that this whole guide, we're working on getting it up and loaded on Changemark, but for now it also sits at the Spencer Creo website, which I'll drop into the chat, the website. And so the guide's there, but feel free to reach out and let us know if we're missing things. Like it's yours to work with, right? So when you think about a time that a researcher's come to you, sometimes in the moment it can be conversation with research back and forth, and you're not asking all the questions that you maybe would have wanted to know based off of this guide. So here's an example of an application form, right? So you're asking the researcher, obviously, their name, contact information, and then you start asking them to like check off the stuff that it applies for. What is the scope? And if nothing checks off, it's maybe not the right researcher, or maybe it's about having that conversation on how to get to the scope, and you ask the question like, why is this research important now, and how it will add to the value of your current context or evidence base. Again, tying into those six principal guidelines is relevance. Is it relevant, right? So this toolkit basically based off of all the things that we're working on in the beginning of the guide, we put it into the usable templates to go through, right? And that's one of the things that you can do when you're sitting down. The researcher can do it with you, they can do it without. And it kind of ties along. The researcher shouldn't have a problem doing this. Like currently, I sit on the Behavioral Research Ethics Board of UBC as a community member. Every researcher needs ethical approval to do research before they should even, coming to you. So these are things that they should have already thought about. A lot of this should already land, but ethical research and like relevance and community research, they overlap in some places, but not in a tangible way, like a toolkit example like this. So it's something in which if again, I'm not slagging on researchers. Researchers are great, but if you're working with a researcher who's not willing to do this, it already sends as a message as if it's the right researcher or not, because every step of the way before they even get to reaching out to community, they would have had to pass ethics. They would have had to pass their. I'm not an academic, but I think it's like their who's a person, a professor or their person who oversees what they're doing, like someone else would have had to. And so you would want to make sure that, that asking of this shouldn't be something that's outside of the norm. Every one of the toolkits, the toolbox in there has a lot of pages that help you guide those conversations. Isabel, are you leaning forward because you love this section? You have something you want to add to it, or?
No, I'm actually I don't have glasses in general, so I'm
Yeah.
trying to read, but it's super interesting, and I was just reading. Sorry,
No, no, don't be. I just wanted to make sure
yeah.
because similar, like, of course, the way my brain works is I'm action. So like theory, love it, part of that, but like an actual to-do list, my brain gets excited, like an actual, like, so like seeing these kind of things similar to you. I love the whole guide, but I'm excited by the tangible work that like workbooks that folks can use to build on that. So yeah, please use the templates of the toolkits as much as it makes sense to you. Make them make sense for your organization. It's just a jumping off. Next slide, which is also me. So yeah, so the how to use it, like we were saying, I think we've said it a couple times, is sometimes you've already started research, you're like, oh wait, I should go back and figure this out. Or maybe you started a conversation with a project, it makes sense, and now it's feeling off. Like this toolkit and this whole guide can be used in real time at any place that you're in. It's the intention is not, unless your brain works this way, the intention is not to read it all the way through and then put it on a shelf, never pull it out again. It's like it's a working workbook. It's something that you can always reflect on. For me, someone that gets to like luckily work with so many like grassroots organizations in the downtown east side, this is also useful in like history and knowledge sharing between a new ED, between a new board, between a new frontline workers, right? So it also just helps if you have a bit of a roadmap of how you want to have done research and how you want to continue to do research and how that can continue if and when people leave the org and somebody else new is in. Like you've already kind of set that path of like ways that you want to do research and do work and how you want to showcase it, how it's relevant, how it's going to be respectful, right? So the way that you want to use this guide is you want to start where you are. Research isn't a linear process, like we said. You might have already gotten into it. You already were jazzed on the research or you're jazzed on the way it's going. And then suddenly now something you're like, oh, wait a second. Use it where you're in the timeline, all the different templates and toolkits all line up for all the different areas and the timeline that you'd be doing research. Use it to reflect. Use the guide for reflection, planning, or active negotiation, right? Again, it could be that the board however you're organized, your collective, you're like, we actually want to work with researchers. Use this to plan how you want to do research and then find your researcher. Research doesn't always have to come to you as well, right? Like there's also stuff that we know and like we know research is important. Research changes policy. Research brings voice to conversations that sometimes aren't having. We've all seen it, the surge of the importance of like peer and persons with living experience. We've known it forever. It's been happening forever, but there's relevance in a lot of conversation and a lot of research coming forward to it. It's how we keep it in the conversation. So you don't always have to wait for researchers to come to you. Create your own research. And use this and share this with your partners. Shape it early to share it early to shape collaboration from the start. So ideally, new relationship with a researcher, you have the guide all the way from beginning to end. Maybe it's a new researcher, but it's the same project and someone stepping in, like just sharing it with your partners. So you want to start where you are, you want to use it to reflect throughout the whole timeline of what is research, and you want to make sure you're sharing it with your partners, just so you have a shared core of collaboration and how you're going to work from. Next slide.
Thank you, Tara. So the guide is laid out in chapters that follow the natural stages of the research partnership. So the first chapter is obviously the beginning, how to build trust, center respect and set the foundation of a partnership. Then we move on to defining roles and expectations. So clarifying what's being asked of community organizations and what's reasonable. Chapter 3 is about ethics. So exploring multiple ethical frameworks, whether they're academic, indigenous, community-based, and who decides what counts as ethical practice. So I personally find this sometimes I find, I don't know, the word ethics doesn't always sound super exciting, but it's so important. And this chapter is actually really well done. So I found it, so I find it really important. Chapter 4 is about data collection, access, and ownership. That's also really important. Negotiating data use, who's going to own the data? Will I have access to the data? Will my service users, know the results? Will we be notified and included when you're writing articles or presenting at conferences? So all of these things need to be discussed, and you're in I was going to use entitled, but yeah, you are entitled to ask for it and to be part of it. Everything that has to do with governance, respecting indigenous data sovereignty as well. And chapter 5 then goes on to returning results. So ensuring that the findings are shared back first with communities, not at scientific conferences first, it comes back to the community before, and in ways that are accessible. So, language needs to be adjusted, and, the format of knowledge translation also needs to be adapted to the community. So it's not just results are not primarily just for researchers and publications. So that's really important. Chapter 6, formalizing the relationship. So using MOUs, partnership agreements, and role cards to set terms of engagement and protect community interests. And then the last chapter is saying no or not yet, because you are allowed to say no or not yet when, the partnership doesn't really align with the community priorities, or just, telling the researchers, I find sometimes, because of how research funding is done, even when working in research, it's we're always feeling rushed because you have a certain timeline, to get things done. But then, then the project should just be planned differently. And the expectations and the expected outcomes should be adapted so that you are slowing down, you're, doing things properly. So, it's okay also to just say to researchers, what, this isn't working for us for the moment. We don't have the capacity. We don't have enough resources to do this project, or maybe, adjust these things and then come back to us, and then we'll reconsider. I also really like the idea that Tara, you were saying how, we don't have to wait for researchers to come with us with research projects. For example, currently I'm starting urban mural project by and for the community in Montreal, and eventually we want to do it in Australia as well. And it is inspired by Smokey D and Trey Helton, who passed away last year. And the amazing work that they're doing in the downtown east side. And the point is that to show that these kinds of projects are important, and to add evidence to scientific evidence that art-based approaches are relevant and important in empowering communities. There has to be research. So what I'm doing actually by building this project, I'm actually using this guide, which is kind of weird because I co-authored it, but I want to make sure myself that I'm doing it properly and that I'm really considering everything. So that project is from the community, and then with this guide, I've approached different researchers that I know will be aligned with what we want to do. So Yeah. And then finally, there's a toolbox, as we already mentioned it a couple of times, so I won't go over that. And, to conclude, I think it's clear, that research should really strengthen and not exploit communities, that the tool that we've presented today is to make that shift real, and, that it's yours to use. And as Tara said, copy left, or I don't know what you said, but it made sense. And we, finally, we want to close by acknowledging all the MySafe participants, providers, and community partners who shared their experiences and inspired this guide, as well as the co-authors and allies who helped write it. And we hope that shared purpose can support their larger shift in how research is done with communities rather than on them. It invites researchers and organizations to slow down, build trust, and make intentional choices about collaborations. When communities have the tools to lead and define success on their own terms, research becomes something that strengthens relationships and generates knowledge that truly serves those involved. So next slide, please.
Okay, awesome. Thanks so much both for walking us through the presentation so far. You both have definitely done a lot of talking, so we'd love to take a moment to hear from everyone on the webinar. If you have any questions, please put those in the Q&A box. Also, if you have any feedback or anything that you would like to share with us about situations that you have faced during research, we'd love to hear it all. So definitely just take a moment to throw that in the chat box, and I'm going to take a moment to stop sharing my screen.
I'm going to jump in for a second, and
I
I'm
can't turn
going
on
to
my
launch
video.
a poll and ask everyone if you could just take a moment to fill out this poll for us. It's really helpful for us for our funding applications and things like that. You could just take a moment and we'll carry on with the discussion.
Sorry, Rebecca, I just wanted to flag, for some reason my video's not working. So I just, yeah, I'm happy to kind of lead the Q&A discussion, but yeah, sorry about that, guys. Oh, here we go. Thanks. So folks, please go ahead and fill out the poll, and we'll get to some questions if anyone has any. I know I have a few. It was really a fantastic presentation. So let me see, do we have any questions? Or folks, if you want, you can raise hands. One question I had was with respect to the toolbox that you guys mentioned. What are some, kind of tangible ways, or what are some of the best ways that you found that community can, link up with researchers, and what are some of the tools and templates or examples of kind of the best ways that that can happen?
So like the best ways that orgs could reach out to researchers to start up a conversation, or when they've already engaged with researchers?
Sorry?
Sorry, I was just looking for clarity on the question. Your request was how organizations can connect with researchers, or
Oh no,
with
what are some of the best ways that that might look like? Like we're referencing the toolbox section of the your document.
Yeah, I guess I don't remember in the toolkit section having anything how to engage, like how you would find researchers. I think it's more so when
What it
researchers are,
looks like,
pardon?
what it might look like.
Got it. Yeah,
When
definitely. So I can use an example of the one page that we had in our slides there. Like one of the ways it could look like then is a researcher, like let's say Isabel's a researcher, she reaches out, she's like, hey, I want to do research. Again, I'll reference the Downtown East Side. I want to do research on folks exiting recovery. Are they, making their way to employment and what do they need. And so I sit down with her and I go over that checklist, and and I ask those questions, get the name and the contact, look over the scope. So it can be really used exactly how it is. Like every toolkit that was created, every template was created was based off of ways that we have engaged previously, the ways that we are engaging. So it's definitely something that can it's used exactly as it is. I would suggest, just because it is definitely relevant to the work that all of us that were creating it have done. It might be not everything that you're doing, is take a look at it, see if you want to add other questions to it. Like, use it as a framework, be like, is this make sense as is? Sometimes when someone gives me a script to ask questions, it's not my language, so I'll change the questions more into my language, right? So that also might be a way to make the toolkit feel more yours. Is I would never structure a sentence like that. So what am I trying to say? Just so it feels more conversationless, unless you do feel like you want, sometimes grilling somebody with a checklist feels not the relation that you're trying to build. So it's more so, I would suggest, is just sitting down with somebody who wants to have this conversation, is willing to go through it. Make sure that the questions read the way that you want, change it to language that makes more sense for you or your organization. So it's a bit of a conversation back and forth. And it just from there builds the one of the guiding principles, which is being collaborative and respectful in the conversation, the back and forth.
And maybe if I can add to that, like, the other way around, like, it's true that, like, knowing, which, like, how do I know which researchers to contact in my area? Like, let's say I want to do, like, a community-based research project. So I was like kind of brainstorming as you're talking, Tara, and I think you can look at different research institutes in your area, depending on the different, like, so you can really Google the different, like, research institutes that exist in your area. Look at as well, universities, like, are there researchers that are linked to the topics that you want to study? um Also maybe ask other community organizations if they've done research in the past, and what positive experiences they had with researchers, maybe which researchers they didn't have positive experiences with. And then and then contact them with some sort of written proposition, have a sit down, and then bring the guide, work through that together, and and be honest, like, this is our first time doing research. We really want, it's really important to us that we are using these, this guide, these tools, this is how we want to proceed. And yeah, so I don't know if there's anything else to add to that.
Thanks, guys.
Isabel, I just want to say I thought it was great that you just did mention about the importance of chatting with other organizations about who are some of the researchers that you've worked with that you've had a really positive experience, who are responsive, because they may not always get it right the first time, and people do make mistakes. But if they're, like, really engaged in learning and being accountable, and, like, I think that's really a big piece. And I've just been thinking that, like, right now, as a community partner, I've been working on a couple of research proposals and grant applications, and we've been reaching out to all these different organizations because we want them to be partners. But how difficult it is for community groups that are, being trying to provide, direct services, engaged in the day-to-day work. And then also trying to find the resources and capacity to be involved in research in the ways that they'd like. And just the importance of really negotiating or navigating, figuring out what resources are there to help support the engagement of an organization, and the different people connected to that organization, if it be it clients or like service users, or employees, or whoever. Like, yeah, just making sure that there are ways to resource the organizations.
It's one of the things that one of the things that lands the most for me is the roadmap to engagement is kind of what the guide is, right? What's the roadmap to engagement? When I've sometimes engaged in ways that I look back, I was like, oh, I wish I would have done that differently. It's because I did it too quickly, and we all work, a lot of us most of us work in a way in which like the day-to-day is so busy, and we do know the importance of the research. So the roadmap just helps the way of having the engagement. And like Isabel said in the last slide or a couple slides back is one of the chapters, no or not yet. So I always forget the no, and I always forget the not yet. And again, not the not yet doesn't mean it's a full on no, it's the not yet. And so it's even with the presentation like today, I make places where I need to stop and pause so that I'm not just like going so fast that I'm not like intentional with it. So for me, when we were creating this, there was so many times that I could reflect back and be like, oh, if I had thought of this, or if I had this toolkit, or if I had this template, I would have asked a different question. And again, everything's a learn. And like Isabel said, is I was a part of the MySafe project, which was a national safe supply project. And when it closed, people died. And would it have closed if research was done better? Hard to say. There's always been an agenda within politics, but off of the backs of the folks that we've lost and the folks that continue to work, I want to make sure I don't make the same mistakes. And I find this guide useful in making sure that I'm not going to make the same mistakes, and that I do participate in research instead of just putting my head in the sand when it feels too busy or it feels too much. And so yeah, I just felt relevant. It was like kind of landing for me as I was listening to people talking.
Um, and maybe like, because from my understanding, I don't think there's questions right now, but yeah, I see Rebecca, yes or no questions? Okay. So I maybe want to come back to Zoe's question earlier. She was asking if the paper was going to be published, maybe about peer-led work, the invisible peer-led work. Maybe what I can do is send it to you, Rebecca and Andre, when it gets published, so you can share it on your network, because I think I think it's going to be really useful for community organizations and also for researchers to, better plan their funding, because recruitment and, engagement is a huge part of it. So maybe I don't know if there's many people left, but maybe I would like to ask the group, what resonated with you most in this presentation. So I'd like to open the floor to your feedback.
Okay. Well, thank you guys. If there's no other questions, I wanted to quickly share that we want to let you know about our February research spotlight, where we have the ABI KTE team coming to share findings from the evaluation of the Prescribed Alternative Workforce Program. The workforce program provides access to prescribed alternatives to harm reduction workers. An interdisciplinary healthcare team provides wraparound psychosocial support to participants. In March and April 2025, surveys and interviews were conducted with participants and staff to evaluate early outcomes of the new workforce cohort and learn more about HRW's experiences as participants of the PA program. This webinar will share evaluation findings of the workforce program, including participant outcomes and experiences, as well as recommendations. I once again want to thank all of our presenters. And Caitlin, was there something that you mentioned that you wanted to share right there at the end before we
Yeah,
go?
definitely. I also, this is a bit late, but I'm just noticing in the chat there were a few comments from folks. So I just want to say thank you for those. It's really nice to read how you find this tool may be useful for you. I definitely am like super excited to read about folks that right away are like, I can use this. I know Robin also commented about working this into their September conference in Vancouver. That would be awesome. If you have any questions or would like Changemark support, we'd love to talk to you about that. And then thanks to everyone as well for the commentary around how this has resonated. Just reading out some of them, not being a sidekick, the reciprocity and responsibility to community, a note that someone's role as a coordinator, in their role, advocacy for the community and researchers, and this tool to do that would be super helpful. So yeah, no, this is just awesome. Thank you so much, everyone, for listening to our presentation. Thank you for your contributions. It's really exciting on our end to see folks using this tool and having this tool spread widely. And I know we talked a lot about like mental health and substance use, but it's also really cool to see some comments about how folks that maybe don't specifically work with those patient populations are also using this tool, because it is really transient for any patient or community population that you do work with. So that's really exciting. But before we pop off, I did just want to mention that our group will likely be back in March with another presentation for you all on an impact report that this team put together that Tara has briefly mentioned. It's on the following of the closure of Canada's first biometric dispensing model for prescribed alternatives, or MySafe. Tara gave little tidbits of that in our introduction today. So that presentation is really going to dive into all the impacts of the model that they had on the patients, and then also the impacts on the closure of the model for folks. So if that sounds interesting to you, stay tuned. If you have any questions at all about the work that we talked about today, about the shared purpose guide, please feel free to contact Changemark through any of our channels. We would absolutely love to hear from you. We also do trainings on the shared purpose guide for both community folks and researchers. And our services do offer sliding scale rates to make this a bit more affordable. So definitely get in touch if that's something that you're interested in. But other than that, I just want to say thank you so much for your time today. Thank you to our hosts for having us. This has been awesome.
I just want to jump into and say thank you, thank you, thank you, thank you. This is exactly the reason that we want to have the Substance Use Health Network, have folks like you come and present about this work. The goal of the Substance Use Health Network is to bring us all together and push the work to be done in a really effective way that's grounded in the lives of and the needs and realities and rights of people who use drugs and other community members. And this is what helps make real partnership happen. So thank you, thank you. Oh, there's one more question from Zoe, Caitlin. Do you do all trauma-informed research trainings? Trauma-informed research trainings. Do you know of any?
Not that I can name out specifically. However, we do have a ton of expertise within our contractor pool. So if you'd like to reach out to us and see if we have the expertise to do the specific research training that you're looking for, we'd love to chat. We've done a number of different trainings in the past, so I'm sure we would.
For sure. And also feel free to reach out to me through Spencer Creo, as well as like all the practicum students that come through. I do trauma informed. Some of them have been in community, some of them haven't. So like it's nothing as official as Changemark, but maybe we should also make a flag of that for something to bring back to Jill. But yeah, reach out. Well, we all are very passionate about ways to combine research and community, and we'll find a way to be useful.
Also, just want to give a thanks to you, Anjay, for being our host today. Really appreciate Reclaim and Reclaim's partnership with the Substance Use Health Network. But also just want to say how much I appreciate you and your engagement with your partnership, all the work you do with the Substance Use Health Network.
Happy to be part of it. It was an amazing presentation.
Yeah, really good stuff. All right. Thank you, everyone.
Thanks all.
Thanks, everyone.
Thanks.
We had a pretty good turnout, folks. Please. I was like, 30 people, but please come 30 people. And it was up to 46, I think. So that's really good.
I couldn't see, so I didn't know. I like, because my screen was small, so I didn't know how many, like if people were there.
I think it's such a valuable tool, and I'm so glad it exists.
Yeah, it's great.
We needed that as a thing, So well done. Well done. I thought we were an hour and a half, but that's okay. We find actually a lot of people do drop off at the 1 hour mark just because people go to meetings and things. So yeah,
that was good timing then. That worked out well.
Yeah.
Excellent. Thanks so much for hosting us and for all the logistical support.
Yes.
Partway through the conversation or the presentation, I realized